Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Before we get started today, I want to make sure and give a big thank you to Hubbard for letting us use their space once again and supporting our production of the podcast. Today, I have a guest on The Preventable, a fellow executive director who I have been able to work with for many years now. So I would like to welcome the executive director of ARCA, Aaron Laxton. Hi, Aaron.
Thank you. Applause.
Yes, the background noise. We can fill that in, right?
That's right. Thank you for having me.
Of course. So I'm excited because as I was thinking about today, and I know that there's probably way more than 30 minutes of things we could talk about, but I was like, ooh, now's my chance to also ask Aaron some really tough questions that I don't know that we've ever really talked about before when we've been in settings where we're, talking business or figuring out partnership opportunities or all of that. But let's start. It's really not that hard of a question, I hope, but what brought you into the field of substance use treatment where you're at now? And tell us a little bit about yourself and how you got here.
Oh, that's a good question. That's an Oprah question right there.
Mm-hmm.
So I'm a social worker by training, but we have to go back a couple of years. I am from a family where both my parents were impacted by substance use. And I also have had my own challenges with substance use over the years. And, I started out in social services as a case manager.
Okay.
And, started to work with individuals who were justice involved, unhoused, LGBT, working with HIV. So that was kind of my space. And, just through the years as I changed agencies and I became introduced to harm reduction. And so that led to the work that I would do with other organizations that are doing that type of work. And then eventually I was led to ARCA, and I've been with the company for 6 years now. And I can't imagine it, not being there. Mm-hmm. But that why, that's a pretty important question. And I think sometimes we get caught up in the inertia of doing whatever we're doing.
Just
right?
The day-to-day grind of it, yeah.
And, I like to tell folks that I've lost 3 family members to fentanyl. Luckily, as the numbers continue to decrease, and I think we all have guarded optimism with those numbers.
Right.
I want to encourage folks we can't let off, right? We can't let off the pressure of all of the work that we're doing with harm reduction, with treatment, with prevention, the work that you're doing with kiddos. All of that work collectively has gotten us to where we are. Mm-hmm. And so I do try to take moments where I reflect on my own childhood, my own parents, my circumstances, and then also remember that the patients and clients that we work with every day, it's a very real reality for them.
And they all have their own story and their own circumstances in life and family situations and all of those things that come together for them too.
Absolutely. And I think, both of our organizations are committed to involving individuals with lived experience.
Absolutely.
And so that is the value of, the peer support model was not a new model. It had been used in mental health for decades. Newer to SUD, right? But that's the real value of anybody who isn't familiar with the peer support model is we're putting individuals who are the closest to substance use, closest to mental health. Either their families have been impacted or they've been impacted. And, we believe that individuals with lived experience are subject matter experts.
Absolutely. I mean, they've been there and done it and experienced it in ways that people that haven't had that same life happening might not fully grasp. And, I think, and we've talked about this a little bit before too, Aaron, that even a person with lived experience is their experience. And so having multiple voices and really make sure that we're tuning into different types of experiences is so important.
Yeah, it made me think of something whenever we're teaching CIT class. we'll tell, those that are attending, if you've met someone with mental health, if you've met someone who they themselves are using, you've met one person.
Right.
It's so different. It changes from person to person. And so, the folks that we run in and come in contact with every day, the kiddos that your organization's coming in contact, the youth, the families, while we know a framework and we think we know kind of what's going on, oh my gosh, there's so much nuance from family to family to, so very important.
Absolutely. So we've said ARCA a couple times. I don't know that everyone listening knows what ARCA stands for, what ARCA does. So tell us a little bit more about ARCA.
That's a good question. So ARCA, affectionately, we're called ARCA, but it's the Assisted Recovery Centers of America. It was really a passion project started by Percy and Judy Menzies about 24 years ago. And if Percy was here, he would tell you that he came from Big Pharma. And he really had a passion for, this idea that substance use treatment could be delivered in a different way, that there were new medications that were on the shelf that were available that had not received the fanfare of some of the other more widely accepted and adopted medications. And so, we often kind of, joke around the clinic is that we went from a clinic where Percy and Judy, Judy having candy in her pockets and she has a really soft touch with the clients that we work with, to now we have a team of about 100 interdisciplinary folks, everyone from peers all the way up to, all of my docs and psychiatry. And so we've come full circle. And so, it's really continuing Percy's passion and being able to partner with amazing organizations like your organizations and others that are in the community doing this really essential work.
Yeah. And, I'll just kind of state, I think, what I know, and you can correct me if I'm wrong, but, ARCA as a partner is great. ARCA has also really been that consistent and kind of forefront provider on the medications, as you described with Percy starting 23 years ago, but then even, as the world was experiencing a worldwide pandemic, starting to branch into more telehealth services, and also truly appreciating the need for those, what we might call wraparound services, right? And so understanding that, treatment is more than just treating a substance use disorder. And, back to what we've already talked about, appreciating the individuals and the layers of complexity there, and that people need different types of support. And I think, at least in my partnership or, experience with ARCA, that is always considered and made sure that's highlighted and uplifted for people as well.
We really try. Every morning we start off with a huddle, and this was kind of born out of the COVID era. I kind of feel like Taylor Swift quoting an era, but the COVID era, and I think we've gotten a little bit past it, so where some of the things we've adopted and life changes and public health changes, and so it's a new norm. But there was a silver lining to COVID, as we all knew. And individuals that were impacted by substance use, the silver lining was that we had the expansion of how we could deliver services. Yeah. For the first time, we could really incorporate telehealth. Now, it was a double whammy, right? Because if you didn't have the infrastructure to expand telehealth, oh my gosh. And so that was one of the big things that we saw. And even right now, there's a lot of legislative action around expanding broadband, right? And so it's interesting that we're, 4 or 5 years later, and now, of course, we're, everything moves very slowly when it comes to funding.
To health and public health and funding.
Yeah. So I think, we do try to impress upon our team. I think one of the values of ARCA is if you are interacting with someone at ARCA, you're probably going to interact with someone who they themselves have been impacted by substance use, or they have a family member. And so, we know what it's like to be dope sick. We know what it's like to not feel well. We know what it's like to have to fill out 3 hours worth of paperwork. We try to reduce it as much as possible. Of course, we can't always, we can't eliminate
things that
it.
have to happen.
Yeah, the inertia of everything, right? But it's really about having that trauma-informed approach that, it's been a buzzword for the last, 5 to 10 years. But really, what does that mean? Yeah. And it may mean that we only get 1 or 2 shots with somebody, right? And the kiddos that you're working with, your organization, may only have 1 touch point. They may only have a couple touch points. And so really planting those seeds of, hey, I came in contact with someone who cares about me. I came in contact with someone who genuinely is concerned and not judging. Right. And so I think that's if there's a magic moment, like Disney puts it, like that's where the magic happens of, we went through a really bad period. And I know I use guarded optimism a lot, where we lost a lot of people. We lost a lot of people to overdose. And I think, for you and I and any of us who've done this work, we may not even be to a point where we can take a collective breath.
Yeah, I had noted that guarded optimism that you said earlier. I was going to come back to that. But, I think that's exactly what it is, that, the numbers show some decreases in overdose deaths. And I think the people that have been doing the work in whatever type of way, we know it takes all the little pieces coming together. There's not one magic answer. But I do appreciate that the people that have been doing the work for a long time now are not patting ourselves on the back. We're not saying, oh, look, the numbers are down and we can relax. That's not happening. I think we all are kind of holding our breath even longer now, thinking, well, we don't want this to be seen as we're done, because we're not done.
And we don't exactly know, look, everyone you talk to would like to think they're the most important, right? Mm-hmm. Prevention wants to think they're the most important piece. STD treatment, we all like the recovery housing, et cetera. The reality is it's all of it. Yeah. It's all of it working in tandem, and it's that continuum of care. And so I think that for me is the thing that I'm hanging on to is we don't know if we back up on one thing, if we back up on prevention, if we pull back on treatment, what that impact's going to be. Right. And so I think, whether you're talking to the researchers or you're talking to frontline staff, anyone that's been in this field for a minute, they're going to tell you the same thing, that, we can't afford to ease up. Yeah. We're there. We've made some headway, and we're moving in the right direction. But, oh my gosh, because we don't know, it's just I think guarded optimism is the best way to put it. It's just very, I would encourage those that have the power to ensure that we have continued funding and support for all these things. It really takes a village. It takes everything.
And I think that, not to go too deep in the other way, but I think that's what's making things really difficult right now, as we're looking at some significant potential funding cuts or funding shifts, and a lot of people in the space questioning, how do we continue to do our work? What does that mean, and what does that look like? I know every nonprofit and executive director has been thinking of these things, probably awake in the middle of the night at some point thinking about some of these. But so, when you're looking forward, what do you think? What are some opportunities you're seeing, or what are some things that you're really concerned about?
Yes.
Yes, all of the above, right?
It is. It's very. First off, thank you for sharing space with me. You and I have worked together for years, and I just have a strong affinity for you and the organization. I think you'd be hard pressed to find any leader right now that isn't concerned. So I think, to answer your question maybe in a different way, just as I said, it takes a village to really kind of tackle the problem. The real worrisome part about, any cuts is, we have to have a conversation about social determinants of health.
Absolutely. So I know what that means, or I think I know what you mean by that, but tell us what it means, and not academia.
Yeah. Yeah. So, social determinants can best be thought of the whole person, right? It's the food, it's the shelter, it's the education, it's the mental health, it's the child care, it's everything that we have in our daily life. And, there's one measure that really stands out to me. And I think if we think about this in relationship to the people that we work with, if today you, on your way here, had a flat tire, do you have one person you could call that could help you fix that? Do you have one person that you could call that could loan you $20, $50, or $100, right? Now, hopefully, if we're lucky, we have 5, 8 people.
Yeah.
We have a lot of the folks that we work with do not have one person.
Right.
Like their resources are very limited. And so that's when we start talking about funding cuts or funding challenges, we're already taking a group of people that are under-resourced, and we're under-resourcing them more, right? And so that's the real challenge. If we get someone in clinic or you're working with someone in your setting, it's one thing to say, hey, don't use drugs.
Right.
That's great. Just say no, right?
Well, that's not what we say, but yeah.
Borrow from the 80s messaging, right? So just don't do drugs.
Right.
Don't do fentanyl.
Here's the impact.
Don't do any of that.
Risk,
That's short-sighted, right? It's just like we tell folks, don't carry firearms, don't carry a gun. That's not the reality for a lot of the folks that we work with, that they live in violent settings where that is a tool to help keep people safe. So I think when we look at the whole person, we have to really look at what are the life circumstances for that individual.
Yes.
And so, using drugs for a lot of the folks that we work with is a trauma response. It's a coping response. And so, for the healthiest thing that we would want to get a patient to is not using.
But there's a lot of other things.
There's a lot of other things. And that's where these cuts are cutting into the other things.
And that's what I've described it in some conversations with my staff and other people is, yes, I mean, there's things that we can be worried about as an organization. I think that, we'll figure some things out. But it's that greater ripple impact that, even if it's not funding directly for our organization, it's going to be in another area that's going to impact our work or going to make our work have more challenges, even when we think about school-based education. So, the Department of Education at the federal level is not going to have any direct say in how we present our programs. We don't receive funding to do school-based prevention education. And if schools have even tighter budgets and less resources for kids, and kids are struggling more in schools than they even are now, us coming in and doing prevention education, 1, becomes more difficult, and 2, becomes even more needed. And so now we're looking at our own capacity and saying, we might have even more work that needs to happen. And how do we do that? So it's that ongoing ripple effect that I think we're going to see over the next couple of years.
And the other challenge, I think, for any administrator is there's something that makes fiscal sense, and then there's moral sense, right? And so, and this is not to get on a soapbox. I would never. Hopefully, I would never dare. You'd push me off if I did.
I would never be on a soapbox, he says.
I think what makes a line item sense on a budget, right? Unless you have been boots on the ground and you've seen the impact on a granular level of that, whatever, right? So recently, not to get off too much on a trail, we've seen that mental health programs for adolescent and school-based programs have been impacted and
Right.
are projected to have cuts.
Mm-hmm.
That's going to have a wide, like you said, I like the word ripple. It's going to have a ripple throughout the entire, you already have a school that might be under-resourced and have one social worker, if they're lucky, for a school, one counselor for a school.
Yeah.
And you're talking about a school that might have, upwards of 700, 800, 900 students.
Absolutely. Yeah, the one social worker is not enough.
Yeah, and so then the answer is, well, we need to refer those kids out to a program.
Mm-hmm.
But then the next question is, what program?
And
Right?
how do we connect with that program? And does that program have the capacity and resources?
Yeah.
And
So those funding cuts, anytime we're talking about a single budget cut or a line item, it always goes to, well, we'll refer them.
Mm-hmm.
Where?
Yeah.
That's the question. That's the, where. And I won't get into the morality of any of this, but I think that there is a message that goes to the folks we serve in a confirmation,
Mm-hmm.
right? That, you can typically see what is of importance to a society by what we fund.
Absolutely. And what we're continuing to value and find support for, and what we're not.
Yeah. And, I also would say, in regards to budget cuts, it is not uncommon. We see budget cuts, during previous administrations. We've had budget cuts. It happened in a bipartisan way. I think, the shock and surprise and awe and maybe the execution of how it's happening now, it's part of, my life and your life every day. We always have funding, that comes and goes. So I think, where there's a will, there's a way. But my biggest thing, you mentioned what keeps me up at night.
Mm-hmm.
It is really, we want to make sure no one gets lost to care. And so, it's definitely something that keeps me up at night.
So, next question. Thinking back and thinking forwards, I'm going to ask you to look two directions at once here. What are some things that you are most excited about, or what changes have you seen in the treatment space that you're like, yes, that is a good move. That was a way that people were really helped, and that's a way that we continue to push and move forward. So I guess, if I asked it different, what changes have you seen in the substance use treatment space that you do get really jazzed about?
Well, it's a good question. I think, we just came back from NatCon in Philadelphia.
Mm-hmm.
Were you there?
I wasn't there. Some of my staff went.
my
I
gosh.
didn't go. Yeah.
Well, I missed you. So I
it's
knew
one of
you,
my favorite conferences.
I know in years past you went. So but it's such a big conference that people can be there.
Thousands of people. Yeah.
Look, I will say that Missouri is doing it well.
Yeah.
We have strong support from our partners, both on state and federal levels. Our partners at Missouri Department of Mental Health.
Mm-hmm.
We have great leadership that is forward-thinking. They're not paying me to say that, but they're innovative, and really when we think about that continuum that I mentioned earlier, everything from someone coming into respite housing. Respite housing is someone who is the closest to use.
Yes.
And so we have multiple respite houses. ARCA has 14 respite beds, 7 male and 7 female. And then that really serves as an entry point for a lot of our folks into recovery housing. We have a pretty robust recovery housing network that we're able to link people to. We have our treatment and not to speak for DMH, we over the last couple of years, we've really been working on ASAM and really restructuring how we look at service delivery.
And how we measure outcomes of treatment.
Absolutely.
Right? Yeah.
And so the last of the organizations that were needed to convert have converted.
Mm-hmm.
And that's been a huge lift. Anybody who's attended any of these work groups or calls, I know we often cross paths on often.
Yes.
That it's one thing to get on calls and talk. It's another thing to do the work. And so I would never be as foolish as to say I'm doing the work. I have an amazing team that does the work, and I get to like run the gamut of congratulatory. But so I think our service delivery is I would put it up against any state. I think we're doing it really well. I've
said that to people before too. I'm like, we could talk Missouri politics. We could talk things Missouri maybe doesn't do so well. But I think in this space, I mean, since before I was even part of this work in this world, when I look back even at the history, I mean, there's been some really smart decisions, some true understanding of, like you said, that continuum and the need for it, all those places to have that support that Missouri, I would agree, has done really well at.
Yeah, it's one of the most exciting. I'm thinking with the previous governor, I think Jay Nixon. Don't quote me on that, but Governor Nixon made special appropriations for community behavioral health liaisons. Mm-hmm. Now, I may not have that right, so you want to fact check that one. But and so now there's close to 200 CBHLs. Mm-hmm. We have youth behavioral health liaisons. Mm-hmm. These folks are tasked with being out in the community, working in crisis situations. So I think broadly our understanding of where are the folks in need. Yeah. And we know crisis situations. We know the hospital system, we know in the jails. And so I think we're doing that. We're doing a great job. Mm-hmm. We have a great CIT network, crisis intervention team network that I think last check, we have CIT represented in maybe 100 of 115 counties.
It's most of them. Yeah.
And, I've seen your educators at those CIT classes and doing the 40-hour trainings. I think that's something we're doing really well. I think back to the treatment, we have some new innovative medications that are really amazing. I'm not paid to say this. Sublocade is a long-acting injectable that we've really seen some amazing things. Naltrexone, obviously, we have folks that maybe they don't want to be on another medication. They don't want to have any impact of medication, which most side effects of meds will subside after they've been on it for a little while. I have to say that I'm not a pharmacist. I'm not a doc, and so I would always say confer with your pharmacist or your medical doctor for any of that information. But I think for the first time in history, we have more medications that are at our patients' disposal, and so that's exciting. Yeah. We want to give our patients as many choices as possible.
Mm-hmm. Absolutely. So if somebody was wanting to connect with you or ARCA, what's the best way they can figure out more?
Yeah, so you can definitely go to our website, arcamidwest.com. You can call our switchboard, 314-645-6840. And then we do walk-in every day of the week, except Sunday. So you can try at our 1430 Olive clinic, which is downtown. That's our largest clinic. And then 14204 West Florissant, that's up in the Delwood area.
Awesome. Well, I appreciate you being here. I feel like we probably could have talked about more, but we'll keep it short for today and maybe at some point do a part 2. So thank you, Aaron. Thank you to our listeners. Thanks again to Hubbard. If you've liked what you've heard and you want to hear more, subscribe to hear more of our podcast at anywhere you listen to your podcast. Thank you.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PrevenTEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.